Keeping our kids in school for in-person learning is one of our priorities. We're working to contain
The state's top public health official bringing up some pretty alarming numbers about the mental health of Arizona teenagers. During a news conference discussing school closings just last week, she talked about this increase in the number of teenage suicides this year. We know it's a sensitive topic, and it's one that here at ABC 15 we've been tracking closely for the last 3 years. But does the pandemic have anything to do with the number of child deaths reported so far this year? Here's ABC 15's Sonu Wasu with a deeper dive on these numbers.
It is too early for us to draw any conclusions about the rates of teen suicide right now. What I can say is that kids are reaching out at a higher rate than they have in previous years. Where we've seen the increase is depression, anxiety, some relationships in terms of not feeling connected or feeling isolated or feeling alone.
Here at Teen Lifeline, trained teenagers work closely with mental health professionals to answer calls coming in from kids all over the valley. 18-year-old Alex is one of the friendly voices they will hear on the other end of that line.
Recently, it's been a lot of feeling alone and feeling like you have nowhere to turn.
The number of calls and texts has increased by 50% this year, which may sound alarming, but it also brings those working in youth advocacy some relief.
So the good news is kids are reaching out, they want the help, and they're going to the resources that we've made them aware of.
We asked Teen Lifeline, what is creating so much anxiety for our children? And we're learning it's not just COVID-19, it's also the recent election, the political divide in the community, social justice issues, and a feeling of guilt that they could be the reason someone they love gets COVID-19.
They do worry about their families. They also worry about their teachers. So while they're not scared of being sick, they are scared that they could create a situation where they make adults sick.
In a press conference last week, Dr. Kara Christ, director of the Department of Health Services, cited some disturbing trends highlighted in a survey taken by students in 2019, a year before the pandemic, showing 40% of Arizona kids admitted to feeling so sad and hopeless, they stopped participating in usual activities.
Almost 21% of the high schoolers responding indicated that they had contemplated suicide.
She goes on to say 16% of those teens actually made a plan to complete suicide, and 10% reported a suicide attempt. The state's health department reports 43 teen suicides so far in 2020, which is higher than the 38 we saw in 2019. Also alarming, the age of children completing suicide. It's getting younger.
We've had 2 12-year-olds and 2 13-year-olds in the East Valley complete suicide between March and present.
While definitely a cause for concern, local youth advocates say it's too early to tell if the pandemic had anything to do with these tragedies.
So people want to say the pandemic is why suicide's increasing, but the reality is we won't have that data for at least 2 years following whenever the pandemic ends, and we don't even know when that will be.
While elected officials throw out numbers and create benchmarks for opening and closing schools, youth advocates fear the real message here is being buried underneath the politics, and that is whether at home or at school, our teenagers need help, a trusted adult they can turn to.
Please ask them if they are safe. It's okay to ask them if they're having thoughts of suicide. And if you don't know what to do, please call Teen Lifeline, that we will help you. We will be there to support you.
That number to call or text is 602-248-8336. We've also got it posted for you on our website, along with warning signs that your child may need help. Just go to abc15.com for more on this story. Sonu Wasu, ABC 15, Arizona.
Sonu, thank you. The National Suicide Prevention Hotline, such an important resource for people of all ages. As I always say, if your child's old enough to have a phone, they're old enough to have this number stored in it. Please put it in their phone.